Hello folks, this is Dr. Kevin Connors with your Members Minute. Today we're going to be talking about Lyme disease, chronic Lyme disease, and how to deal with it if we can't stimulate a Th1 response. If you don't know what that is, watch our other videos and watch the immune system videos. So your Th1 response is your killer response that we can't stimulate. We want to utilize the immune system, but if we stimulate something that's overstimulated already, we're going to cause a lot of problems. So we have to kill it by other means. We're going to leave the nutraceutical approach out of it because we can talk about it another time. I want to talk about the Rife machine. The Rife machine is a key component of what we're going to do. Rife is named after a guy named Royal Raymond Rife who passed away a number of years ago, who theorized that using quantum physics to our advantage, using frequencies of the tissue that we're trying to destroy or the tissue that we're trying to affect, can have good effects on the body. So let me give you a little synopsis. From a quantum physics perspective, all matter is, down to its smallest particle, energy that vibrates at a specific frequency. So your cancer cells vibrate at a specific frequency. So do Lyme pathogens, Borrelia burgdorferi, all the co-infections vibrate at a specific frequency. Your liver cells vibrate at a specific frequency. Everything does. So if you can hit a healthy tissue at a specific frequency, you cause it to vibrate. And that can be good. It can bring it back to resonance. It can help balance its frequency. It can give it energy. If you hit a pathogen at a specific frequency, you cause it to vibrate as well. Well, it doesn't necessarily kill the pathogen directly, but when you cause it to vibrate, you can cause it to be recognized by an immune response. So let's put it in pictorial terms here. So let's make a picture of this. So we have chronic Lyme and a pathogen. So here's my tissue cell, part of a tissue cell. And I have a spirochete, this Lyme disease, living in my tissue cell. My immune system, here's a macrophage out here, circulating around my bloodstream, trying to find the pathogen and trying to kill it. If I can hit this Lyme disease with this frequency beam, and it causes this to vibrate, it can cause this macrophage to recognize there's something going on inside that cell, and it actually engulfs that cell and destroys the cell and destroys the spirochete in the process. Now normally, if a virus invades a cell, the virus invading the cell puts up a little marker on the outside of the cell, kind of like a tag, like, hello, we've been invaded, and a circulating lymphocyte or macrophage, white blood cell will say, whoa, there's something inside that cell, kind of like a bank robber comes in to rob a bank, and the teller hits a button underneath the counter telling the police there's bank robbers in here, and the police drive by and, oh, there's a signal at First National Bank, so they stop in and they arrest the bank robber before he gets out, and he goes, how did they find me? Well, the teller hit the button. That's what cells have the ability to do. They hit this button and this marker comes out, simplifying here, and this protein marker signifies, it's a signal to your Th1 cytokines that there's an invader in there and it surrounds the cell and kills it. Well, then why do people get chronic Lyme? Well, there's some disorders, there's some pathogens that have the ability to disable that marker. So then the marker never goes up, and the cell is invaded, and this Lyme disease is replicating and growing and having a party inside the cell, and the cell's like hitting the button, hitting the button, hitting the button, and the police aren't coming. If you can hit it with a Rife machine, with the frequency, you cause it to vibrate, and you're basically signaling a white blood cell response to that cell. That's one reason why the Rife works. There's many other theories. Nobody can even say that it doesn't work. You're just trying to figure out how it works. That's one reason why it works.